Now you see that I love toys. So laser, if you've gone to a conference, you'll see it's a light. But if I increase the power, it generates heat. It's similar to a lamp. A light bulb is a source of light, but if we touch it, we can burn our fingers. So what we do is we thread the laser into the vein, and the heat seals the vein. So that's how lasers work. Now, one thing that always amazes me, and again, I will always be honest with you. So if we use a needle that, well, I'm not going to draw it because I'll scare you away, but let's say we use a needle that's huge. I'm going to tell you. Now, the truth is we don't use any huge needles. And again, I'm going to look in the camera and say that again. I will always be honest with you, okay? Now, what we do is we start out by numbing an area right here, usually the inside of the thigh. You're in our ultrasound room, you're lying on the table, okay? Now, you feel a little bee there. Now, again, here's the vein, and that's the blood going in the reverse direction. What we do is we thread a series of tubes through that area into the vein, on up to the groin where the problem starts, okay? Now, I always do this wrong, so bear with me. Now, the laser filament is, and I just showed one of my kind assistants here what it looks like, and that's actually bigger than the laser filament. I'm not even sure it'll show up on the camera, but it's teeny. Every time I do this procedure, I'm amazed that something that small can generate enough heat that will close down the veins. Now, when you look at a light bulb, you'll see a jaggedy filament. That's where the light comes from. That's where the heat would be generated. This filament does the same thing. So that's attached to, and the fellows here can attest to what looks like a clear fishing wire. Now it's actually smaller than that. But that allows me to insert the laser into the vein, okay? So when we have you all set, the laser filament is at the top, and then the tubing is basically threads down through the vein and out, okay? Now this is attached to the laser machine itself. Now, probably the most important part of what we do is we put fluid around the vein. Now, let's pretend you were a burning brush in your backyard. You'd put it in a pile, and then you'd surround it with water or dirt. Actually, that was good. It's blue for water. So you surround it with that, and the main reason is that you don't want the heat or the flames to spread and get your lawn, bushes, etc. Well, we do the same thing. We want the heat to stay within the vein. We do not want to injure or have the heat affect any of the tissue around it. So what we do is a series of injections. Now again, this is essentially exactly the size of the needle. I always say that it's the size of a needle, the smallest one you use to turn up a hem. So it's teeny, but a needle's a needle, so I'm not going to lie to you. You do feel the poke, but it's not horrible. But we do a series of injections, and our goal is to have lots of fluid around that vein. Now the fluid is essentially IV fluid. It's saline or salt water, and then we put xylocaine in it, numbing medicine. The saline, the fluid, absorbs the heat and protects the tissue, and the xylocaine keeps you from feeling the laser. So now we've done that, and we try really hard to make sure there's lots of fluid in there, and I can count on one hand I've probably done, I don't know, 2,000 or 3,000 lasers, and maybe 3 or 4 times people have felt a little bit of heat. If they do, we stop, we put more fluid in, okay? So now you're good to go. Now, what we do, and I'm sorry, someday I'll figure out how to do this right. But again, there's the filament. And essentially, let's see, do you have a pen over there? I think there's one there. Thank you. So pretend this silver part is the filament, okay? And this is the top of the vein. What we do is I just simply, and remember the tubing is there, I just simply pull it out. And the filament is gradually sealing the vein as I'm coming down because the heat is coming from that, and then out I come. Now, from the time I walk in to the time I leave, it takes about 15 to 20 minutes. The time that we did a laser the most quickly was 12 minutes. Now, our goal is not to rush, but the point is that this is a very quick process. Now, as you can imagine, when you see this, the majority of this is the prep work. The actual laser, where I'm pulling back as I described, maybe takes a minute to a minute and a half. So honestly, a lot of this is boring. It's just the prep to do the procedure. And patients are always surprised when the actual laser part takes such a short period of time. Now, when you're done with that, first of all, this area will be numb because we've numbed it, which is a good thing. We don't want you to feel anything. And you will have one little area where we've inserted the tubing that is teeny. I try to make it so you can barely see it the next day, and so you will have no scarring. And you basically will have no scarring. But we will put a dressing on it, if you can hand me the next care there, that will have, you probably know what 4x4s are. That's what I need. And essentially we'll put, just a little bit of dressing on, and then we adhere it with this. Now, we will put on that, right on that, we will put, and I'll hold this up in a second, the time when we want you to remove it. And we'll do it so it faces you, okay? And there's very little bleeding, as you might imagine, since we put a bunch of fluid here, that some of the fluid may seep out, although it usually doesn't. Now, it's very important that you take this off when we tell you to. A lot of people think if they leave it on overnight that it actually will work better. Well, it doesn't. You don't need it. If there's any sort of fluid coming out, put a Band-Aid on. But we have many people who leave it on and then they end up with irritation around it. So take this off when we tell you to, okay? Now, we have finished the procedure, again, 15 to 20 minutes. Then you're walked into the room, and then we will review with you the instructions afterwards.